Hi everybody, this is Dr. Al in Australia. Let's review some commonly mispronounced terms and procedures in medicine. X-ray. It's X-ray, X-ray. And be aware, we use an X-ray, not a X-ray.
I think we should take an X-ray, then stitch him up.
We have an X-ray room.
I'll set the bone and take him for an X-ray later.
Need an X-ray?
It's hard to tell if he may have lost some function in his toes without an X-ray.
MRI. There's nothing wrong with the pronunciation of MRI itself. As you know, MRI stands for magnetic, resonance, imaging, magnetic resonance imaging.
I thought it stood for magnetic resonance imaging.
Nothing really, just some rudimentary magnetic resonance imaging.
But again, be aware that we use an MRI, not a MRI.
At least do an MRI to confirm.
Showing me an MRI scan.
Of course, if you want a CAT scan or an MRI, you're going to have to go into Pittsburgh.
There was a tumor and an MRI.
Listen, if I think it's necessary, I'd want to get an MRI, EEG, and neuropsych testing, agree?
Ultrasound. It's ultrasound. And again, we use an ultrasound.
I'm an ultrasound technician, ma'am.
Do an ultrasound? Let's do an ultrasound.
I'm going to do an ultrasound.
Is she having an ultrasound or a baby?
Endoscopy. It's endoscopy.
So, what I'd like to do next is a motility test and an endoscopy.
But with the x-rays and the endoscopy and the MRI, it's pretty clear.
Endoscopy, colonoscopy, cholesterol, high glycerides, low glycerides.
Endoscopy confirmed the vomiting was caused by variceal bleeding.
Will the endoscopy be painful?
Colonoscopy. It's colonoscopy.
Meanwhile, I want to prep you for a colonoscopy.
The last thing I need is having IAD shoving a Hubble telescope up my ass for a full-on colonoscopy.
Having a colonoscopy in the middle of Times Square.
Yeah, he's performing a public colonoscopy.
Volunteer for a colonoscopy or something.
Oh, that's a colonoscopy.
Laparoscopy. It's laparoscopy.
Want to perform an immediate laparoscopy?
An exploratory laparoscopy.
Laparotomy. It's laparotomy.
I did a full laparotomy.
Or an exploratory laparotomy?
So what we're going to need to do is a laparotomy.
I saw you switched off on our exploratory laparotomy this afternoon.
Mammography. It's mammography.
Your world stops when you hear there's a lump in the mammography. Your world stops.
The field is changing. It has to do with mammography.
Passionate people, if you want to get her aside and talk about issues related to mammography and screening.
Ways of looking at the breast besides mammography and ultrasound.
Radiography. It's radiography.
She's now a lecturer in radiography.
With a mobile radiography unit, we can be x-raying troops.
Barium It's barium meal.
However, sometimes a barium swallow or barium meal may be performed instead.
We should do a barium swallow for Mallory Weiss.
Parents suggested her blood pressure drop during the barium swallow.
Amniocentesis. It's amniocentesis.
So glad you've decided on the amniocentesis.
He would like her to have an amniocentesis performed as soon as possible.
You have to get an amniocentesis.
Well, you can get a DNA sample at the amniocentesis and...
Amniocentesis.
Amniocentesis is a simple procedure.
Stay with me.